Hello, today we are going to talk about 15 bizarre psychological disorders. We have often heard about many psychological disorders from movies and articles and all. But today we'll be discussing about a few rare psychological disorders. So let's see them in detail. First, COTARD'S syndrome. COTARD'S syndrome, which is also known as walking corpse syndrome, walking dead body syndrome, or COTARD'S delusion. It is a rare mental disorder in which the affected person holds the delusional belief that they are dead, do not exist, or putrefying, or have lost their blood or internal organs. In 1818, the neurologist Jules Cotard described this condition as delirium of negation. It can also occur with other disorders like schizophrenia or depression, which can be treated with medications or ECTs. Second, split brain. Split brain or callosal syndrome is a type of disconnection syndrome when the corpus callosum connecting the two hemispheres of the brain is severed or cut to some degree. It is an association of symptoms produced by disruption of or interference with the connection between the hemispheres of the brain. This disorder leads to problems in physical coordination, information processing, and even split personality. Third, FREGOLI delusion. The FREGOLI delusion is a rare disorder in which a person holds a delusional belief that different people are in fact a single person who changes appearance or are in disguise. This commonly occurs with schizophrenia. Fourth, STENDHAL syndrome. Stendhal's syndrome or Florence syndrome is a psychosomatic condition involving rapid heartbeat, fainting, confusion, and even hallucination, allegedly occurring when individuals become exposed to objects, artworks, or phenomena of great beauty. The affliction is named after the 19th century French author Stendhal, a pseudonym of Maria Bendry Bailey. Fifth, Alice in Wonderland syndrome. Alice in Wonderland syndrome describes a set of symptoms with alteration of body image. An alteration of visual perception is found in that way that the sizes of the body parts or sizes of external objects are perceived incorrectly. It is a rare neurological disorder that affects the sense of vision, sensation, touch, and hearing, as well as the perception of one's own body image. Migraines, nausea, dizziness, and agitation are also commonly associated symptoms. Sixth, reduplicative paramnesia. It is a delusional belief that a place or location has been duplicated, existing in two or more places simultaneously, or that it has been relocated to another site. It has been reported in the context of a number of neurological disorders including stroke, intracerebral hemorrhage, tumor, dementia, encephalopathy, and various psychiatric disorders. 7. Stockholm syndrome. It is a psychological response that occurs when the hostages or abuse victims bond with their captors or abusers. This psychological connection develops over the course of the days, weeks, months, or even years of captivity or abuse. A person who develops this syndrome often experiences symptoms of post-traumatic stress, nightmares, insomnia, flashbacks, a tendency to startle easily, confusion, and difficulty trusting others. The name of the syndrome is derived from a botched bank robbery in Stockholm in Sweden. 8. LIMA syndrome. It is the exact opposite of Stockholm syndrome. LIMA syndrome is a phenomenon in which the abductors develop sympathy for their captives. This was named after the abduction of Japanese ambassador's residence in Lima, Peru in 1996 by members of a terrorist group. 9. TRISKAIDEKAPHOBIA. It is a fear or avoidance of the number 13. The term was used as early as in 1910 by Isidore Couriet in Abnormal Psychology. This number 13 can give stress disorders or panic attacks. 10. Panic attack. Panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. It can be very frightening for those facing it. When this occurs, you might think you're losing control, having a heart attack, or even dying. 11. The Jumping Frenchmen of Maine syndrome. The Jumping Frenchmen of Maine were a group of 19th century lumberjacks who exhibited a rare disorder of unknown origin. Individuals with this condition were first found in Moosehead Lake region of Maine, which was first described by George Miller Baird in 1878. He recorded individuals who would obey any command given suddenly, even if it meant striking a loved one. The jumping Frenchman seemed to react abnormally to sudden stimuli. 12th, CAPGRAS syndrome. This syndrome is named for Joseph CAPGRAS, a French psychiatrist who explored the illusion of doubles. Those with this syndrome hold the delusional belief that someone in their life, usually a spouse, a close friend, or a family member, has been replaced by an imposter. It can occur in patients with schizophrenia, dementia, epilepsy, and after traumatic brain injury. 13. Alien hand syndrome. This syndrome is characterized by the belief that one's hand does not belong to oneself, but that it has its own life. This syndrome may occur with individuals who have damage in their corpus callosum. Other causes include stroke and damage to the parietal lobe. The hands then appear to be in intermanual conflict or ideomotor apraxia. That means they act in opposition to one another. 14. Dysthymia. Persistent depressive disorder, also called dysthymia, is a continuous, that is a long-term form of depression. You may lose interest in normal daily activities, feel hopeless, lack productivity, and have low self-esteem and overall feeling of inadequacy. 15th and the last one, apotemnophilia. It is also known as body integrity identity disorder. It is characterized by overwhelming desire to amputate healthy parts of the body. Though not much is known about this disorder, but it is believed to be neurological. Those affected may attempt to amputate their own limbs or damage the limbs so that surgical amputation is necessary. It may be related to right parietal lobe damage in the brain. So this was all about rare psychological disorders. If you like this video, please share it with your friends and dear ones. Hope to see you soon with the next video. Till then, take care. Bye.